Good afternoon. Thank you for joining us today. I'm Kim Johnson and serve as the Secretary of the California Health and Human Services Agency. I am thrilled to announce the launch of California's Public Health Network Innovation Exchange, or Phoenix. This is an effort to not only address the public health gaps created by the federal administration, but also an effort to accelerate public health innovation, collaboration, and communication at the state, national, and global levels in support of your health. The exchange will serve as a hub for advancing modern tools, best in class science, and coordinated responses to emerging health threats. Thank you, Governor Newsom, for your leadership and to the partnership of the California legislature who have invested in our ability to realize this collaboration for the betterment of Californians. This effort builds on additional work we have announced, including the establishment of the West Coast Health Alliance, the newly formed Governor's Public Health Alliance, our Public Health for All Californians Together, or FACT Coalition, and California being the first state in the nation to join the World Health Organization Global Outbreak Alert Response Network. We've also updated vaccine policy via changes to state law to ensure we continue to lead with science, and we've even done more. So now we have the exchange as yet another example of California's commitment to your health and well-being. Thank you to the three phenomenal health leaders for your partnership and California's exceptional public health officer, Dr. Pan, all of whom you'll be hearing from today. Dr. Susan Monarez is a globally recognized leader in health innovation, biomedical technology, and global health security, and also served as the most recent CDC director. She will serve as a strategic health technology and funding advisor and will lead the development of relationships and collaborations with private sector, technology, and academic partners to advance technological innovations. Dr. Deborah Howry, a physician, public health executive, and recent CDC chief medical officer, will serve as a senior regional and global public health medical advisor for the exchange. Dr. Howry will engage existing public health alliances and organizations to develop a larger and more sustainable public health network across the local to global spectrum. And finally, Dr. Caitlin Jetlina, an epidemiologist and one of nation's leading scientific communicators, will advise the California Department of Public Health on the critical need to maintain public confidence in the institutions that keep Californians safe. The department is the launch partner for the Project Stethoscope, a program of your local epidemiologist led by Dr. Jetlina, that helps rebuild connections between communities and public health institutions, trusted sources of information. And as a mother and grandmother, I am appreciative of having trusted messengers to guide my decisions on how to keep my family healthy. With that, Dr. Monarez, thank you for your leadership and collaboration, and I will turn it over to you.
Thank you, Secretary Johnson, and thank you, Governor, for allowing us to be here today. I'm very excited to continue my long history of driving technology innovation to improve health outcomes, and so happy to be returning to California to spend dedicated time to support this effort. As Secretary Johnson has outlined, Phoenix, the Public Health Network Innovation Exchange, lays the foundation of a new future of public health in California. When it comes to health technology and innovation, California is uniquely positioned to lead this moment. California is home to many of the world's largest AI and technology companies, thousands of biotechnology and life sciences companies, and dozens of globally recognized academic and research institutions. California is also so fortunate to have some of the world's leading private and philanthropic investors collectively supporting billions of dollars in health technology innovation across the state and around the world. Aligned with the overall goals of Phoenix, I will provide California with support to harness these extraordinary assets by working alongside non-government investment and innovation partners to transform California's health ecosystem. California's technology innovation focus under Phoenix will include many different aspects of the health ecosystem, including developing advanced digital health capabilities such as real-time public health and information exchange, AI-enabled biodetection and risk analytics, and secure standards-based data interoperability. Along these lines, this effort will accelerate California's data modernization efforts, developing new technologies that will replace fragmented manual processes with scalable cloud-based interoperable infrastructure. Many of these capabilities developed under this initiative will also strengthen global health security by enabling faster detection, information sharing, and coordinated response to emerging health threats. California is leading the way to no longer sit on the sidelines and hope for a better future. California is investing and innovating now to build the public health systems that will protect lives, strengthen communities, and create a future in which all Californians can thrive. I'm very, very excited to be participating. Thank you very much. And now I will turn it over to Dr. Deb Oury, who until very recently served as CDC's Chief Medical Officer, and I'm so excited to be working with her again. Dr. Oury.
Thank you, Susan, and it's great to be working with this really phenomenal team. California is stepping forward at such a pivotal moment, positioning itself not only protect its own communities, but really to serve as a model for how states can lead together in an era of shifting federal priorities, constrained resources, and evolving health threats. Rather than waiting for uncertainty to define the future, California is investing now in leadership, innovation, and collaboration, creating approaches that can be adapted and scaled by other states across the nation. California has a unique opportunity to demonstrate what is possible when states lead together. This work is intentionally designed to partner with other states across regions and across political lines so that we can strengthen public health in a way that is collaborative, practical, and grounded in shared challenges. In partnership with other states, Phoenix will explore shared information exchange frameworks that allow for faster detection, clearer situational awareness, and more coordinated responses to emerging threats. Phoenix will also focus on optimizing regional efficiencies because we know that not every capability needs to be duplicated in every state. This includes exploring regional approaches to specialized laboratory testing, advanced analytics, and evidence-based public health guidance that can be shared across states to improve speed, quality, and sustainability. And finally, at the global level, these efforts will improve visibility into emerging health threats and strengthen cross-border information sharing and preparedness. And with that, I'm now delighted to introduce Dr. Caitlin Jetelina, the founder and CEO of Your Local Epi.
Thank you, Deb. And hello, everyone. Thanks for having me. I'm Caitlin Jetelina. I'm a mom. I'm a San Diegan. I'm an epidemiologist and scientific communicator, and I am so excited to be working again with my colleagues in California after advising 3 CDC directors. There are 2 things unmistakably clear right now. One is that Americans are living in a chaotic health information environment. Countering falsehoods and rumors, and especially those coming from the highest levels of federal leadership, is essential because too often patients and communities are forced to sort through the noise without support. But this is also not enough. Americans also need an offense. Our health systems were built for another time, and they must be reimagined for the 21st century. So this means actually responding to what people are experiencing on the ground. It means elevating lived experiences. It means anticipating needs. And it means meeting people where they are. So this is what I've been building at Your Local Epidemiologist for the past 6 years, is a stronger connective tissue between scientists and experts and institutions and the people those systems are meant to serve. So while Erica Pon and Deb and Susan strengthen data systems and build on incredible innovation, my team is focused on this last final mile, ensuring these advances reach, reflect, and respond to Californians themselves. Data and innovation really only matter if they translate into clarity, into trust, and into action. Something that people see themselves in and feel right where they live. So in California, we are going to be listening more closely to the health questions and confusion and frustrations as they emerge in communities. We are partnering with trusted messengers across the state, and we will be empowering individuals with clear health information to make decisions for themselves and their loved ones. We are all together stepping up to create a health ecosystem that puts people first, and I am ecstatic to be a part of it. Now I will turn over to Dr. Erica Pon, our fierce leader in this movement. Erica, on to you.
Thank you so much, Caitlin. I am very lucky to lead this incredible health department where we have experienced and dedicated teams who serve Californians every single day. We already leverage the deep public health and scientific expertise within our state and local health departments and across our state to protect and promote healthy communities. And now, during this current uncertainty and instability in our federal health landscape, it is more important than ever for us to strengthen our partnerships and with others around the nation and the globe, and to forge cross-sector collaborations to transform and move public health forward. I am absolutely thrilled to work with these phenomenal leaders to innovate, collaborate, and communicate. Together, we will strengthen and create a network of networks that will focus on innovation, developing advanced tools and funding frameworks to secure a sustainable future to keep our communities healthy. By rethinking how we continue towards our vision for thriving families and individuals in the current environment, we will identify approaches that others can adapt to effectively address challenges in public health and prevention in a coordinated way across health and other sectors from a local to global perspective. It's also a top priority of mine to work with these and other partners to increase, improve, and change the way we communicate, to listen to our community, and provide the information people need and want to empower themselves to make healthy choices for themselves and the people they love. By working with these three national health leaders to advise us, we will continue to ensure that public health strategies are based on the best available science and tools. Together, we will set a vision and set the stage, advancing model public health systems for the nation. With that, I will turn it over to Governor Newsom. Thank you.
Thank you, Erica. Thank you to all these extraordinary leaders, all five of you. I'm humbled and gratified by not only the fact that you've assembled here today and have organized a framework that we are advancing in this news conference, but all of your demonstrable leadership over the course of many, many years. And, you know, just looking at five leaders who all happen to be women, I just say this: women rule. We're deeply blessed by your example and your willingness to engage at this critical time. Look, I think you've all said what needed to be said around the issues of truth and trust and noise and anxiety, all the stacking of stress that particularly parents feel. I appreciate Caitlin saying, first and foremost, she's a mother. Well, I'll say reciprocate in context of just being a father of four young kids, a 9 to 16-year-old that went through the vaccine protocols, that went through COVID together, that continue to try to reconcile the world we're living in, where we see this assault on science and truth and trust, where we're seeing scientific inquiry being attacked. We're seeing the CDC itself kneecapped by this administration, mass firings, massive budget cuts, indiscriminate budget cuts, politically motivated targeting of individuals that speak truth and stand up tall, pushing back against the ideology that seems to have now entered in at next level and scale into our public discourse. And so we felt a sense of responsibility, a sense of accountability in the spirit of Isaiah. We need to be repairers of the breach. And as Caitlin also referenced, we also felt we needed to do more than just play defense. We needed to get on the offense. In that spirit, during COVID, we created the West Coast Alliance, which was around a West Coast offense in the vernacular of the great Coach Walsh here in California. And we aligned with some of our Western leaders, and we've tried to replicate, we've tried to braid that back together, knit that back together by getting the benefits, not only of the leadership up in Oregon and Washington, but also in Hawaii as well. And it's all about partnership. It's all about building capacity. It is about, it was said, networks of networks. It's about data. It's about transparency. It's about stress testing what we're being told, what we're being fed. And it's about being responsible to do better and do more. And we also recognize we need to do more as it relates to innovation and bringing that entrepreneurial mindset. I love that. I mean, Susan, come on, she was doing ARPA and all this next level innovation. That's what we need. And we were out, we saw that she was moving on, and we immediately reached out and said, hey, are you available to talk? And here we are, the fruits of those conversations. She said, don't stop with me. What about Deb? Just incredible leader that's been there for years and years and years. And the fact that Deb was available, and we needed someone to translate to human so much of this. And Caitlin, thank you again for doing that. It gets so complicated, and it just adds to our anxiety and stress in this space. And so when you add all those things together, this opportunity to, focus on innovation, focus on networking partnerships, and to focus that three-legged stool on being able to communicate a sense of well-being and to address all the anxiety that people are feeling. It presented itself anew with this partnership. We were able to sneak in some money in last year's budget in anticipation of this opportunity, and here we are at such a precious and potent and powerful time. There's not a day there's not a week that goes by where someone honestly doesn't come up and say, I don't know what to do with it. Hepatitis B being assaulted, all these vaccines, and measles is presenting itself anew. All the anxiety that people are feeling, the confusion they're feeling. They say, well, what can we do? And this is exactly the answer to that question. This is what we can do. We can provide that platform to rebuild trust and provide it on the biggest stage outside the CDC itself in America. It's California, where the size of 21 state populations combined. There's no infrastructure of health investment anywhere in this country that is at the size, scope, and scale of the state of California. And we punch above our weight. And that's why I'm also proud, and I appreciate Kim referencing the fact that we're asserting ourselves globally in this unique partnership we've created, only state in the country that's been able to do that with the World Health Organization as well. Again, filling voids. We're not trying to replicate anything at scale. We're not naive about the size of the federal government. It's not a shadow CDC we're creating, but it's a shield to what's going on. And it's a way of answering the question of, instead of having indignation, it's about leaning with innovation. It's about fundamentally being held to a higher level of accountability at a critical and important time in our nation's history. And I'll close on this. As a parent, I mean, we're standing with nurses, we're standing with doctors, we're standing with physicians, we're standing with the scientists, and we're standing up for patients. That's what this is all about. And we're trying to just cut through all the BS that's going on in Washington, D.C., and the vandalism and the wrecking ball on truth and trust that is occurring in real time. Evidence-based, science-backed, with humility and grace. Again, it's about the best available science, and it's always about looking back and how can we do more? How can we be better? And so we'll bring that to this cause as well. But again, I'm grateful for this opportunity to highlight and share more publicly with all of you what we're doing. And I'm so blessed on behalf of the California legislature that is enthusiastically supporting this effort in partnership with these three other remarkable states that we're able to do something that few can do at a time that is critical in rebuilding trust and continue to transform our system of public health in this state and lead by example all across this country. So thank you again, Dr. Pond, for you helping make all of this happen. And Secretary Johnson, thank you for your ongoing leadership in this space. And we're now happy to answer any questions that anybody has.
We'll now transition to the Q&A portion of the program. If you are a member of the media and you would like to ask a question, please click the raise hand icon at the bottom of your screen and then unmute yourself when called upon. If we are unable to get to every question, please email your question to govpressoffice@gov.ca.gov following the conclusion of the press conference. With that, our first individual in queue is Alex Michelson with CNN.
Hi, Governor. Alex Michelson here. I have two questions, one on topic and one off topic. In terms of on topic, if you can just talk more broadly about the concept of trust itself. and how you're thinking about that in this time of so much disinformation and AI and so much confusion. And the off-topic one is, can you expand upon your feelings about Rob Reiner and his impact on California, on politics, on the Democratic Party, and your relationship with him?
Well, just on that, because you hit my heartstrings. I was on a Zoom with the Reiners just a few weeks back, and had this wonderful conversation, comparing notes, and was just reminded about how consistent they've been, how constant they've been in the cause of not just protecting democracy, but promoting well-being, social justice, racial justice, economic justice. When Alex, I was out there feeling a little alone doing same-sex marriage in 2004. It was Rob who reached out. It's how I got to know him, saying he had my back at a time when a lot of members of my own party, the Democratic Party, didn't. And so he's been a friend for decades. And he's actually was their co-host on an event that I'm doing later this week. So it just breaks my heart. And I don't know enough. We don't know enough. But if, indeed, an own member of their own family, how do you unpack that? And, that just hits home in every way, shape, or form in terms of, again, what we're even fighting for here today, and just trying to continue to lead by example. But anyway, my heart goes out to his family and this terrible tragedy. As it relates to the issue of trust and truth, it just, I think, back to just this notion of humility and grace. Alex, and I've mentioned this before, we've been going through a process, and we're very, very shortly going to be presenting it, really looking and stress testing at what we did right and what we did wrong during COVID. And I think that's how you rebuild trust, is you stress test things. You can't act in an ideological way. And I think folks are accused often, sometimes rightly, sometimes unfairly, of acting in an ideological prison. And so you have to put that to the test. That's what transparency is about, accountability broadly. And that's what I think you need to bring to this endeavor. And that's exactly what these three remarkable leaders have committed to. And this three-legged stool that I reference, it is about rebuilding trust. At the core, it's about rebuilding trust to public health. It's about addressing the anxiety that every parent feels at this moment about all that noise that's out there, and what they do, and who can they trust at this moment. And it's about, as I suggested, the 10 pole of accountability. You got to fill the void. It's not, again, good enough just to talk about the way the world should be. You got to enter into that fray, into that void, and you got to assert yourself. And that's what we're doing. And we're doing it with others in the spirit. If you want to go fast, go alone. But if you want to go far, you got to go together. And it's that spirit of networking and partnership that also, I think, is critical in a bipartisan, post-partisan way of rebuilding trust.
Our next reporter in the queue is Melody Gutierrez from the LA Times. Melody, please unmute yourself.
Thank you. I appreciate it. Governor, can you talk a little bit? You said there was money in the last budget. Can you explain a little bit more on what the budget for Phoenix will look like? Will there be additional hires? As well as, will there be cost sharing with other states? Just a little bit more information on what this budget situation looks like.
Yeah, we've been working on that just through the West Coast Alliance and how that looks, as well as the 15 governors that we're partnered with that governors partnership that we've advanced. And so we're looking at being more resourceful, not just putting resources up in terms of sharing staff in the context of sharing this networked capacity to engage with our collective staffs and compare and contrast, and make sure that all of us are stress testing and all of us are aligned. But we put $4 million in the budget, specific to your question, last year. We could break that down, maybe do that offline. Could show you where we'll start to allocate those dollars as we move forward. But look, this whole idea was about to build momentum and fill that void. And to the extent that we can continue to build more collaborators and more consultants, bring more people to the table, I think this is so foundational. At the end of the day, this is universal. And I don't know if there's a topic that has struck more of a chord in the last many months than public health in this country, not least of which, and forgive me for not being so self-evident, it's table stakes, but the cuts that this administration, not just placed in terms of the burdens to CDC, but the cuts to Medicaid are next level. It's unprecedented in U.S. history, these kinds of cuts. And so it's going to put even more stress on our systems. And that's why it's so important we bring back that relationship to truth, trust, and build back a relationship to what we do best, and that's innovating and maintaining our cutting edge disciplines so that we can reduce costs and ultimately provide more at a time where we're not seeing that kind of contribution that we've seen in the past from the federal government.
Our next question comes from Rachel Bluth at Politico. Rachel, please unmute yourself.
Hi, thanks so much for taking our questions. I have two. First, Governor, if you could give us some specifics on what exactly this program, this partnership or network is going to do that the state of California isn't already doing in terms of gathering and sharing information and innovating. And also for Dr. Monarez, I'm wondering if you could tell us what you're thinking of ACIP's new Hep B recommendations on vaccines. I would love to get your thoughts on that. Thanks.
I appreciate it. And I'll circle back after you talk to Susan and Erica. But Erica, you and I were describing behind their back this dream team. And that's how we describe these three remarkable leaders. And you started to initiate these conversations in terms of the things that we're out there constantly looking at stress testing, getting consultants. We hire more formally consultants. We always are looking for advice and counsel, fresh set of perspectives, fresh set of eyes. But Erica, perhaps you can walk in more detail as you scope out, as you have scoped out the relationship to these three new roles that we've identified.
Sure, happy to. I think sort of some themes that you've heard, but really innovation, and that was one of your questions to Dr. Monarez, who will speak more about that. But in innovation in a few different ways. Again, making sure we have the right tools and the best available tools, and also innovation around how we actually have our funding frameworks, which is part of your other question. Like, health is important to everybody. How do we make sure we work more closely across different sectors to resource the health that we all care so much about? And then as far as collaboration, I think as Secretary Johnson and Governor Newsom mentioned, we're really building on a lot of other networks and alliances, but wanting to make sure that we're doing that, more strategically and really understanding this evolving ecosystem in public health. And so Dr. Howery is really, with her longstanding work at CDC and working with partners across the country, can really help us glue these networks along those lines together. And then, just can't say enough too about how important communication is to trust and how we do rethink again and innovate actually in how we communicate. We've done a lot of unidirectional communication in public health in the past, and just getting information out there. But how do you listen and hear that feedback and understand what information do people need to make decisions for themselves? I think that's really, and back to lessons learned from COVID, I think we really need to do a better job hearing what people need to know and make sure they're getting good information for themselves. So those kind of a highlight of the three different pillars and how these amazing leaders are going to help us.
Susan?
Yeah, thank you. So first, I want to follow up just a little bit on what Dr. Pond had highlighted on the innovation front. As the governor mentioned in his opening remarks, I have spent a great deal of my career focused on science, technology, innovation, and adopting it to practice and to create better health outcomes. And so what Dr. Pond and Secretary Johnson and Governor Newsom have allowed is for a new model to be able to leverage all of those incredible assets that California has in biotechnology and in biotech, and the incredible investor and philanthropic communities that are in California, and creating new public-private partnerships to accelerate technologies in alignment with some of our biggest health challenges and get them from development into operations. And so that's a lot of the work that I'll be doing to help support California. And again, having spent many years there quite some time ago, and now coming back to California, you can feel that there's just really transformation that is at the ready. And so excited to help accelerate this initiative. Regarding the ACIP, and I certainly will want Dr. Howery to chime in here as well. as you know, I am very concerned about any type of decision making that is not predicated on science and data and evidence. And what I think we're seeing now is even within the ACIP members themselves, the discord between whether or not sufficient science and evidence is being brought forward in a defensible and credible way to make these really difficult decisions, these difficult recommendations that will impact the lives of families and of children, and making sure that if there is not sufficient science and evidence to go forward with those decisions, that you do have other sources like what's happening in California and other states to be able to take a step back and say, wait, we don't agree with what's happening because we don't see the science and the evidence that's being put forward. And so whether it's Hep B or any of the decisions that are being promulgated through the ACIP, I would encourage everyone to make sure that they understand the science, understand the data, understand the evidence, and before accepting a recommendation and following through on whatever may cascade downstream from that, is being able to work with credible sources to be able to really ensure that the right data and evidence is being used to support those decision makings. But I want to make sure that Dr. Oury has an opportunity to also chime in here.
Thanks, Susan. And what I would say is it comes down to data, science, and protecting kids, right? That's what we all want to do. The data and science shows that if you delay the hepatitis B vaccine by 2 months, you're going to get 1,400 additional cases of hepatitis and liver disease and up to 400 additional deaths. So to me, that's heartbreaking, it's devastating, and it's wrong. We should be letting science and data drive what we do to take care of patients. The other thing too is for this vaccine committee meeting, there was no new data, no new safety signals, really no reason to reevaluate. That's what's concerning to me, is if we're going to reevaluate the childhood vaccine schedule or anything else, we need to do it based on new science and not relitigating things or bringing ideology into it. We all want to make sure that kids live safe, really fulfilling lives. And I want to thank the governor and Dr. Pond for their statement following the science and the data and rejecting the hepatitis B recommendation from ACIP.
Well said.
Our next question in queue goes to Kristen Wong with Cal Matters. Kristen, if you could please unmute yourself.
Thank you, Governor, for taking these questions. I have two questions that kind of dovetail together on the technology side, and then I have a separate question. The two technology questions are sort of, can you give me an example or a specific sort of goal or problem that this initiative is going to try and address? And then the dovetailing question is, like, does that build upon, or how does this work with the future of public health work that has already been done in California? Yeah. And then my separate question, I apologize, is just that, public health, particularly when it comes to infectious disease, is very hard to do in a bubble. And so have other states or groups already agreed to partner with California in this effort?
Yeah, I see. Erica, why don't you jump in, and then I'll build on your comments, because I know you have very specific things you want to add.
Sure. I think just to really highlight, what's really clear, and actually building on future of public health, is we have gained a lot as far as improving the ways healthcare reports data to public health, and how we also want to improve how we get data back to healthcare. So, when you're have a case of measles, for example, that needs to get reported to a local health department. That local health department needs to act on that. They need to find out who was exposed to measles. Were there any pregnant women? Were there any babies? They might need an intervention within the next 2 to 3 days, and that needs to happen in a timely way. And we had very, very outdated ways to do all those things prior to the pandemic. And we've built some really great technology that we want to build upon even further and improve data exchange between healthcare and public health, so that we can all have better situational awareness and follow health trends over time. And then just to briefly touch on, we already, as mentioned, have been working a lot with other states, and already prior to all of this have worked with those states as well. But we certainly want to make sure that we develop tools that can be scalable and used in other states and really more consistent across different states. Right now, we do have a hodgepodge, across the country of how we're doing this. And we really want to not only not get left behind, but accelerate some innovation in this way to, again, improve healthcare sort of an awareness and reporting that is already helping us respond more quickly to outbreaks and, measles, whooping cough, all those kinds of things are really important for public health to be able to respond to quickly and for us to know where are the biggest health problems and how do we help prioritize our resources to address them.
And just into the collaborative frame, it's interesting, just even this morning, may get them in trouble, but full disclosure, Josh Green reached out from Hawaii to the group with Bob Ferguson and Tina, myself. Our chiefs of staff meet consistently. The Reproductive Freedom Alliance, this healthcare alliance, was formed out of a similar collaborative, which has even more governors in more states. We're collaborating with the East Coast. There's a framework along the lines of what we're doing on the East Coast, and we're collaborating with them. It's all in that spirit of partnership. And the great thing is it's really taking shape organically, bottom up, and it's happening at the staff level in a very meaningful and substantive way. And I think this just portends opportunity to get it to even a totally different level. And that goes to the spirit of the first part of your question. Look, California is very prideful on its innovation. We're doing more on Gen AI in this space than any other large state in the country, but we can do more still. Amy Tong is part of this, which is our innovation, former ODI Data Innovation Officer. She's going to be leading a lot of these efforts in collaboration, coordination with this team. But we're bringing next level talent and understanding of a national perspective that is just a wealth of information and insight into what's going on at the CDC or what's no longer going on that will help us take this even further. Our Office of Healthcare Affordability also can be aided and abetted through a lot of this as we're trying to do numeric goals in terms of setting criteria to start really looking at costs, reducing costs. That's what our $11 insulin's about. It's not about subsidizing costs, it's about lowering costs, reducing costs. So it's all in that spirit that we're trying to bring to this. Susan's ability to reach out to the folks at the UC system and to talk about that translational capacity of research into the commercial side of things, the ability to reach out to philanthropy and the engagement she's already had in the past, same with Deb, that just presents itself anew. And anyone that's watched Caitlin and her ability to communicate, we just sit there and go, it's like a go-to site for all of us. And we're already learning from her, but it's always a day or two behind. Now we're going to get the benefit and help shape some of that conversation and comms. And I think it's so, I'll tell you, you'll see a lot of that coming out of the COVID report, the after action, how powerfully important communication is in this space to push back against lies and ideology, conspiracy theorists and the like, and again, to guide the science and guide good and appropriate decision making.
We'll have time for two more questions. Our next question in the queue goes to Ashley Zavala. Ashley, please unmute yourself.
Hi, Governor. I also have an off-topic question, but it's a timely one, given that the federal court battle over Proposition 50 started today. And I just wanted to get your take and just confirmation that Democratic attorneys, I should say, arguing this on behalf of Democrats, have essentially tried to keep Paul Mitchell from testifying and have signaled to the court that they basically don't want that to happen. I just want to make sure that's something you're okay with, that the map drawer of Prop 50 isn't giving federal judges insight into the process or the thinking behind the drawing of the maps. And second, just any other thoughts you have on this court case as it moves forward.
I'm just confident we're going to win on the merits. The people of the state of California overwhelmingly supported redrawing these maps. I think the case was made even stronger by the Supreme Court where they upheld the maps in Texas. If you look at the language of a number of the judges where they referenced the partisan nature of what we did in California to make the case that Texas was moving in a similar manner only reinforces that confidence. As it relates to litigation strategy, I leave that to the lawyers. I know my status, and it is not as a legal expert. That's why we hire them. And to the extent that they're presenting a strategy or a case and the details and nuances related to that, I defer to them in that respect. But we're very confident that we'll be successful in this endeavor. And may I say, just to sort of connect it back to this larger endeavor, I think this is reflective of that effort as well. That we're not just wringing our hands right now. We're fighting back. We're being a positive alternative to what's happening in Washington, D.C., not just rhetorically, not just style, but substance. And this is a substantive response to what is not happening in Washington. That was a substantive response to the effort to try to rig next year's election. And I'm really proud of this state and our state of mind as it relates to these efforts to meet this moment head on and to assert ourselves and to have the capacity to do that. And again, I believe that maybe in the last question, in the spirit that we opened up, and that is truly the ability to attract the best minds out there. And I'm just humbled and blessed by these three remarkable leaders that they were willing to engage with us. They're willing on behalf of not just the 40 million people we represent here in California, but tens of millions, hundreds of millions of more that are looking for leadership and that are really scared about what's going on in public health and at the CDC today, and for that matter, more broadly at HSS, that they have these remarkable people that are willing to raise their hand and say, we're going to be part of the solution, and we're going to help support a strategy to address that anxiety. They're the antidote to that anxiety, and I'm grateful to all of them. With that, Dr. Pound, any closing remarks as we sign off? Any final things that weren't said that we should have said? Kim?
I'll just say, again, really thrilled about this opportunity. This is about upholding science, integrity, and trust, and really looking forward to our way forward together. Thank you.
We have your back, California, and more. And we're showing up for you. Here we are.
Can we make Caitlin the final word since she is the word guru?
No, I'm just honored to fight for Californians. As a fellow Californian, as a mom, this is an incredibly terrifying time. And it is time to find courage. It is time to demonstrate trustworthiness, not just to declare it. And we're all going to do our very darn best to step up and take this forward. So thank you, Governor Newsom. Thank you, Susan, Deb, Erica, Kim. I'm so excited about this.
Now I'm going to feel guilty. Deb and Susan, any final words? Just before we close the loop here.
Just the same. I am so excited by the opportunity to do the thing that I love the most, which is to accelerate health technology and innovation to produce better health outcomes for everyone. So thank you for the opportunity.
Well said.
And I'm just thrilled to work with this great team. And I know that California will really be a model for other states and around the world. So for me, it's just wonderful to be able to take care of patients and communities, and look forward to working with everyone. Thank you.
Well, I'm going to lie and I'll close it out because you just reminded me of a wonderful quote in the spirit of Pericles, who said to the Athenians, "We do not imitate, for we are a model to others." And I think that's the spirit I think defines the best of California. I say that with humility, but I do feel that sense of responsibility and to model better behavior. So with that, we thank all of you for tuning in, and we look forward to talking a lot more as we advance this initiative and we highlight some of the successes and the early wins, and we continue to expand the scope and scale with other